We had a vision back in 2017 of an opportunity to bring together groups of healthcare providers in the upstate of South Carolina. So Southeastern Health Partners was formed by actually originally 3 partners, Bon Secours St. Francis, EnMed Health, and Spartanburg Regional. And there were 3 large health systems in the upstate there. We started with a contract with CMS for the Medicare Shared Savings Program. And which makes us a little different is that each of our partners has their own clinically integrated network, which is involved of medical groups, their health system, as well as independents in the community that they serve. What we've done is now brought all of those local CINs together to a large CIN. And that's allowing us to share best practices. It's allowed us to integrate through clinical terms and grow and to actually build a better relationship in the community for developing care.
There were quite a few challenges that we faced before partnering with MedInsight. Mostly it was about getting the data that we wanted. Now in our case we're a little bit unique because we had actually been working with one of our partners' instances of MedInsight. So when I came into the whole process, we were already using MedInsight but not the way we wanted to because it had been customized for one of the 4 groups that we're involved in.
We had a challenge with attribution, and so that is something that we had early on. When we received data from payers, we did not necessarily know which one of our partners was the right place of care. We knew that we were accountable and responsible. And in partnering with MedInsights, we've been able to go deeper, to put in some custom strategies and formulas that have put us into a very high percentage of attribution identification. That's huge when you're going into a practice and trying to develop change at point of care. Talking to a provider about the need to change on a patient that's not even theirs doesn't go very far. So we think that's been a great success. I think seeing, and I would name that as probably right off the bat number 1. I don't think our financial return would not exist if we did not have a relationship with MedInsight. We need the data. We need a place to actually manage it and pull it out and look specifically so that we know where to target areas. We engage care management. We do have things such as complex case management, transitions of care. The data that you provide allows us to move into specifying which patients rise to the top. We talk about a triangle of care with patients that ultimately you have high-risk patients, rising risk patients, and healthy patients. We want to understand where those patients live on that continuum, and that's been a success with using the data and the claims data that we've gotten from MedInsight. I'm very excited about the clinical integration project that we are getting ready to embark on. That's a pilot that we are able to work with MedInsight to develop higher capabilities of near real-time data.
When people ask me what my favorite thing about working with MedInsight is, it's simple. It's the people. I love the folks at MedInsight. I love collaborating with them. I love all that they bring to the table because you have really, really smart people at MedInsight. They're also fun, and it's fun working with them. And that makes the whole collaboration work so much better, and it lets us innovate, truly.
Claims data is great for the reasons that I've shared previously, that we're able to see a full picture of a patient, but it is in arrears and it's yesterday's news. And so the opportunity to take that data and blend that with clinical data that is happening yesterday, day before, a week ago, allows us to engage caregivers at a time when the patient really needs it. And that's critical for us. So this is going to be a huge project. It's also going to allow us to integrate information from other partners, some of our independents that are in our network, that today we don't have a lens at their data. So I think that's what I look forward to the most, and I think it's going to be an exciting new year for us.